Today, we're going to be discussing pandemic prevention, preparedness, and response. My name is Dr. Jay Varma. I'm a physician, epidemiologist, and public health expert. And if you'd like to see more information about this topic, please visit my website at drjvarma.com. Here are the topics that we're going to discuss today. First, what have we learned from past pandemics? Second, are we in a new age of pandemics? Third, how can we prevent pandemics? Fourth, how can we prepare better for pandemics? And fifth, how can we respond better to pandemics? Let's start with discussing the past. Here's a table of major pandemics that have occurred throughout history. The important thing to keep in mind here is that basically since recorded written human history, there have been periods when pandemics swept through society and caused a massive disruption, not just to health, but to political and social stability. The earliest documented pandemic is the Plague of Athens, which is estimated to kill over 100,000 people, occurring over 400 years BC. But of course, that is only the beginning of a long period of pandemics. As we see through here, through major periods like the Black Plague during the Middle Ages, and eventually into our modern times, where we've had HIV/AIDS, SARS, H1N1, chikungunya, Zika, and of course, COVID-19. Let's talk about one of the most important pandemics in the most past 100 years. This is the 1918 influenza pandemic. It's estimated to have killed at least 50 million people worldwide, including 650,000 here in the United States. When we think about infectious diseases, we like to describe three characteristics of them. One is the host. What are the factors about the humans or animals that led people to get sick? What is it about the environment that facilitated the transmission of infection? And what is it about the pathogen itself that was problematic and dangerous? So in this situation, in the 1918, of course, there was widespread malnutrition and co-infections, a much earlier era before widespread availability of vaccines and antibiotics. Second, the conditions of the environment. There was crowding, there was poor sanitation, and the war, World War I, which was engaged in almost all continents of the world. And then finally, the pathogen, influenza itself. It is believed that this strain of influenza emerged in birds, either wild or domestic, or in pigs. What was most notable about it was that it was highly lethal, especially in those 20 to 40 years old. There were major challenges, of course, during this period in history. There were no diagnostic tests for influenza, no national systems to monitor clinical illness, and no vaccines or drugs to treat influenza. Now, interestingly enough, many of the same problems that we experienced and saw during COVID-19 were also a problem during the Great Influenza pandemic. First, there were extensive debates about whether to close businesses, churches, and schools to reduce transmission. Masks became an intense topic of debate, very similar to during COVID-19. As you can see in these images here, there were anti-mask leagues that were set up, groups of people that banded together to resist the wearing of masks. A constant, ongoing public debate about when can we be done with the flu, the same type of fatigue that people felt during COVID-19. Notably, there was a major event that also prompted a lot of debate throughout history, recent history, about when is the right time for public health officials to make decisions to restrict activity. In September of 1918, there was a massive effort to raise money for the war effort. And parades were being held so that promote people to buy bonds, which would funnel money to the government to help support the war effort. In Philadelphia, the city health director authorized this parade because he was under political pressure to avoid a panic related to the flu and, of course, create a positive atmosphere for the war effort. But because the city health director bended to those political pressures, there was a massive epidemic of influenza in the city, and that within 72 hours after that parade, hospitals were completely full. So this is a very similar debate to the one that we saw during COVID-19 about social restrictions. So, what are some of the key health legacies of the 1918 flu pandemic? The first is there was widespread interest after this in creating government public health agencies. Second, there was the development of national surveillance systems to track disease rates. Third, epidemiology became a legitimate science, that is, a field that could be used to plan public policy. Fourth, universal healthcare became to be recognized as a right throughout the world. Interestingly enough, the United States almost got its version of universal healthcare until last minute negotiations shifted it into the version that currently exists in the US, where most health insurance is provided by employers. And finally, very similar to COVID 19, there was an effort to improve indoor air ventilation. In New York City, where I live, for example, windows were installed in schools sometimes for the very first time. The next major pandemic in recent times was the HIV pandemic. This is considered the second most deadly pandemic of the 20th century, with over 37 million deaths recorded to date and counting. It is believed that HIV as a virus emerged first in primates and then spilled over into humans, likely in the late 1900s in Central Africa. Sorry, correct that. Likely in the late to early 1900s. More than 50 years later, however, is when it was finally recognized as a disease in 1981. And this is 15 years later after that official recognition until an effective treatment became available. And it remains a leading cause of death in many communities around the world. Now, with HIV, we saw similar problems again as we've seen now during COVID 19. Illness and death were heavily concentrated in the most marginalized populations. There was an ongoing question about how many deaths are acceptable. Is it acceptable for people to die from the disease if the treatment is too costly? And is a pandemic over even when most countries do not have access to effective control measures? We know that HIV in the United States in 2025 has effective prevention and treatment opportunities available to most people. But that is not true in many places around the world where HIV continues to be widespread. Some of the important key health legacies of the HIV pandemic were this phrase, no research about us without us. Specifically, what that means is that research studies should not be planned only by researchers. They should be planned by the people who are actually going to be impacted by the findings of that research. There became expedited pathways for research and access to new drugs. There was demand from low-income countries for the same standard of care as people in high-income countries. And global health institutions were developed, new mechanisms were created to facilitate the delivery of important health commodities. Everything from condoms to antiretroviral therapy to diagnostic tests for HIV and related health problems. So, what have we learned from all of these past pandemics? If there's one common lesson throughout all of these, it's that pandemics cut through society's weakest seams, and strengthening those seams will reduce illness and death. So, it's critically important to remember that it's not just the disease that's the problem, it is these social and health and political situations in a country or in a community that determine how much death and illness there will be from this disease. So, what we're talking about is laws that structure, enable, and enforce public health, healthcare, universal healthcare for people who become sick, paid sick leave, economic inequality, structural racism, social cohesion. All of these factors have a major impact on whether a new emerging disease will cause widespread illness and death or whether it can be mitigated. We've also learned that pandemics cause a massive disruption across many different sectors. These are not just problems about health. They disrupt science. They promote innovation in prevention, diagnosis, and treatment. They provoke changes in government, changes in laws, organizations, and financing. They make changes to the economy. It can destroy some industries and create new ones. Think, for example, about teleworking and teleconferences that are now widespread on video platforms that didn't really exist in any widespread way before the pandemic. And the arts. Pandemics have always prompted artists, those who live, to create great works of tragedy and comedy. And we've also learned from pandemics that not all is hopeless. We've shown that we can actually defeat pathogens. One human virus has already been eradicated from the earth, smallpox, and others cause substantially less disease than they ever have had during recorded history through global efforts such as polio, measles, and rubella. But defeating these pathogens requires a sustained commitment to strengthening public health systems, strengthening healthcare delivery systems, strengthening social and civic organizations and services, and what we call a One Health approach, where we don't look at human health in isolation, but also consider and deal with the health of animals and the physical environment. Now that we've talked about the past, let's look at how pandemics impact the present. What we've seen in recent times is that diseases are emerging and spreading faster than ever. More viruses are spilling over from animal species into humans. 3 novel coronaviruses, for example, have emerged in the past 20 years: SARS, MERS, and COVID. Influenza and HIV were also spillovers from animal populations into humans. And once these infections spill over, they are also spreading faster than ever. More people are living in cities and receiving hospital-based care. Transmission is amplified in cities and in hospitals. And there's now the rapid global spread around the world through migration and travel, particularly via the air. This is a figure showing the emergence of new diseases over the past several decades and how the increase has been quite sustained over the past 20 years. What determines the likelihood that a pathogen will spill over from the animal population into the human population? First, we need to consider the prevalence of the pathogen in animal species. What percentage of animals have this pathogen living in them at any given time? And then we need to consider what is the frequency and intensity of human contact with those animals. Research has identified factors that can increase the risk of spillover by bringing people, animals, and pathogens closely together. Land use changes, for example, deforestation, consumption and trade in animals, such as wildlife markets, as was seen in Wuhan during COVID, and poor infection prevention and control when raising animals for food. Climate change is one of the most important factors we see in the emergence and spread of new emerging diseases. Climate change alters the ecosystems, bringing humans, animals, and vectors into contact in ways that they have not been before. It alters the range of habitats for mosquitoes, ticks, and animals. It promotes migration due to droughts, changes in arable land, and extreme weather events. So here's the big question. Where will the next pandemic emerge? Well, many studies have tried to examine all of these drivers in spillover and emergence and to prioritize what are known as hotspots, areas in which we think it is most likely for a disease to emerge. But the problem is that these predictions have failed the real-world test. For example, MERS arose in areas of the Middle East. Influenza H1N1 is believed to have arisen in central Mexico, and neither of these regions of the world have previously been prioritized as hotspots for new diseases. When we think about not just where a pathogen will emerge, we also want to know what pathogen will emerge next. And there are many different expert groups that have studied this question and come to somewhat similar conclusions. On this slide, you see on the left side, you see World Health Organization's list of priority viruses for new emergence. And on the right, we see the list prepared by the Coalition for Epidemic Preparedness and Interventions. What's their vaccine priority list? And we see at the top of both of these lists are coronaviruses. We also see what's known as filoviruses, such as Ebola and Marburg, Lassa fever virus, Nipah virus, and related viruses called Henipaviruses. Rift Valley fever viruses, and what's termed pathogen X, which is really just a way of saying we have no idea and we need to be prepared for the unknown. What are some of the pathogen factors that increase risk? In other words, what is it about some pathogens that makes us more worried than others? Without question, the fastest way for an infection to spread through the community is to be spread through the respiratory route because we all share the same air and humans always gather together. It's part of our nature as a species. And so any type of infection in which we are that can be spread through the respiratory route and that can involve us breathing shared air is going to spread rapidly. The second is the ability of an infection to spread during the early stages of infection, particularly before symptom onset. This was an important factor for COVID before there was widespread immunity from infections or from vaccines. The virus was found to replicate rapidly in people before it caused any symptoms and be transmissible to other people. The third factor is the lack of prior immunity among humans. If the virus is or bacteria is novel and humans do not have any pre-existing immunity, it's going to cause much more illness and death than it would otherwise. And finally, there's transmission through other means, such as mosquitoes, such as Anopheles or Aedes mosquitoes, which are widespread in temperate air and tropical areas around the world. So now that we've talked about the past and the present nature of pandemics, let's talk about the ways that we can prevent pandemics, prepare for them, and respond to them. When it comes to prevention, I think one of the most hotly debated topics is whether primary prevention of pandemics is possible. That is it possible that we could never get pandemics in the future if we did the right things? Well, there are multiple lines of evidence that suggest it is possible to reduce the frequency of spillovers and to slow the emergence of new diseases. Unfortunately, this is not a scientific question that is readily amenable to a randomized clinical trial. Instead, it requires us taking action based on what's known as the precautionary principle. That is, it is better to act now, even with uncertain information, than it is to wait for the future. And the estimated cost for trying to address prevention at its source, primary prevention, is only about $10 billion a year for the entire globe, which is quite low when you think about the expenditures we have for many other types of major problems that we have. What are some of the ways in which that money would be spent? First is stopping deforestation, enforce existing environmental laws, reducing incentives for clearing forests and jungles, paying communities to steward and conserve land, providing services to forest communities. And this also has the added benefit of reducing climate change. There are other critical ways that this money could be used to prevent pandemics. We can reduce human-wildlife contact in spillover areas. We can strengthen biosecurity in animal husbandry, including physical enclosures, quarantines, providing safe food and water to animals, and using vaccines and better animal health service. And finally, we can close or tightly regulate wildlife markets and trade. Now, while it's possible, of course, and we hope it's going to be successful to prevent pandemics, we also have to be prepared for pandemics if they arise. The essential component of any pandemic preparedness plan is that it must be an all of government and an all of society plan. That is, we can't just leave it to elements of the health sector, like hospitals or clinics or public health agencies. All sectors of the economy and all aspects of government need to be considered in pandemic preparedness. We need to have comprehensive threat assessments. We need to measure what is the likelihood of threat. What are the consequences of that threat, including the possibility of public outrage? What is our vulnerability? And what is the complexity of mitigating these threats and vulnerabilities? An essential component of all plan is that we have laws that structure, enable, empower, and enforce public health. We need to have incident management systems across all sectors if and when pandemics occur. We need to have planned for pharmaceutical and non-pharmaceutical interventions. And we must train and exercise because we can't be prepared if we haven't already thought through how we would act and we haven't already exercised it in scenarios. An important component of pandemic preparedness is early detection and modeling. We need to improve our disease diagnostics for humans, animals, and the environment. We need to strengthen what's known as public health surveillance, which is the ongoing and systematic collection, analysis, and interpretation of health related data that is essential to planning, implementation, and evaluation of public health practice. We need processes, staff, and systems for rapid electronic data transfer, cleaning, analysis, and interpretation. Two of the major aspects of early detection and modeling are known as nowcasting and forecasting. Nowcasting is our estimate of how much disease is there right now, accounting for things like underdiagnosis and lags in reporting. Forecasting is our attempt to estimate how much disease might there be in the near future when comparing different scenarios. We need to have a wide spectrum of medical countermeasures. Primarily, this includes medications for prophylaxis, for treatment, and also having vaccines. And it should also include supportive supplies, such as ventilators, devices, and protective equipment. And it must be informed by our threat assessments. For example, do you stockpile ciprofloxacin to prepare for an inhalational anthrax bioterrorism attack? This was a major concern, obviously, after the 2001 attacks in the United States. Is it still a risk? Is that risk increasing or decreasing? How many ventilators will you need in different scenarios? And these plans for medical countermeasures require us to have extensive coordination across national, state, and local jurisdictions, especially because in the United States and in many countries, there are national pharmaceutical stockpiles that are used to help all jurisdictions in case of major health emergencies. There are other types of countermeasures as well, too. We often refer to these as non-pharmaceutical interventions. These include things like investigating cases of disease and doing contact tracing, quarantine and isolation. Quarantine refers to separating people who are healthy but have been exposed to a disease. Isolation refers to keeping people who actually have a disease, people who are sick, away from other people until they are no longer infectious. Other countermeasures include ventilation and indoor air quality improvements. And then, of course, social distancing, which involves restrictions on individual behavior, gatherings, businesses, and schools. And this is an area of tremendous controversy during COVID and continues to be a source of ongoing debate because we know that any type of government action to restrict individual freedom is going to create opposition. People want to protect their own health, certainly, but they also want to maintain their freedom. And there is a constant and massive disagreement among many different people about how much my individual freedom should be restricted to potentially benefit people outside of my family and maybe even well beyond my immediate community. An important area of pandemic preparedness is to strengthen healthcare infection prevention and control. Hospitals are common locations where outbreaks are amplified. COVID, Ebola, MERS, antimicrobial resistant pathogens, all of these are amplified in hospitals and in clinics. And healthcare infection prevention and control is more than just having commodities like personal protective equipment. It requires laws and regulation. It requires personnel to monitor, investigate, and control. And it requires labs to do high quality testing, including genotyping. Unfortunately, there is limited investment in this area globally, even though an issue of patient safety, occupational safety, and community safety. All of these aspects should motivate people to care more about it, but unfortunately, this area remains widely neglected. We must also worry about the spread of disinformation and misinformation. Disinformation refers to false information that is deliberately spread to deceive. Misinformation refers to false information that isn't deliberately spread to deceive. Unfortunately, it's unclear if we can effectively immunize large populations against either disinformation or misinformation. Most worrisome is the growing strength of the anti vaccine movement, which has gained new force with social media channels. Then, of course, we need to do training and exercises, as I mentioned previously. We need to work across public health, medical, and veterinary workforces, policymakers, the private sector, community groups, and citizenry. We need to do training such as tabletop exercises as well as full scale exercises when people simulate a real world event. And one of the main benefits of these exercises is building a team. An important statement in all emergency, important principle in all emergency management is the first time you meet someone on your team should not be during the emergency. That is, these exercises help build camaraderie and teamwork among people so that when the actual real emergency occurs, people know each other, have a relationship, and can work better together. So we know that despite our best efforts to prevent, our efforts to repair, we are also going to have to respond if and when pandemics occur. The essential components of response is that there has to be integration and coordination across governments and communities. We need to use management sciences to advance equity during our response and to improve supply chains, staffing, coordination, and outreach during emergencies. We need to identify and support communities at highest risk due to structural racism, economic equality, and other factors. And we need to use communications and advocacy to promote the uptake of control measures, to combat infodemics like misinformation and disinformation, and to promote support for health security investments. Throughout all of this, one of the most difficult and most important aspects is risk communication. On this slide, I'm listing some of the key principles of risk communication. These are derived from guidance that CDC has previously issued and extensive studies on how to communicate most effectively. So if you're an official or in any type of leadership position, be first. Be the first one out there to make sure people know what's going on. Be right. Be credible. Express empathy for the people who are impacted. Promote action. Show respect. And key, highly important, acknowledge uncertainty. Feel comfortable saying, here's what I know. Here's what I don't know. And here's what I'm going to do to figure this out. And here's when I'm going to tell it to you. This slide goes into greater detail to give you some of the examples of how we can prepare better to communicate. Think about the lists of questions that people might be asking you. Are my family and I safe? What can I do to protect myself and my family? Who's in charge here? What can we expect? Why did this happen? Why wasn't this prevented? What else can go wrong? When did you begin working on this? And what does this information mean? All of these are critical aspects of pandemic prevention, preparedness, and response. And as we live in an era in which diseases are emerging faster than ever, and they're spreading around the world faster than ever, we need to be as prepared as possible for a future in which we all can protect our health and safety. Thank you.